awesome. Let's kick this off. Welcome, welcome, welcome to Doctors for Dancers presents Keeping Your Feet Happy. I am Galit Friedländer, your hostess with the mostest, if I may say that. I think maybe other people need to say that about me. Wait a second. But I am here so excited to host this today. All right. So without any further ado, I'm going to introduce, we have a panelist of 3 esteemed guests. We have Dr. Teresa Ronna, Dr. Lisa Shoene, and Dr. Jessica Randolph. We're going to start with a presentation by Dr. Teresa Ronna.
We're going to discuss what is a stress fracture, what are some of the symptoms, who is at risk, how do we diagnose the stress fracture, prevention, and treatment. So the definition of a stress fracture is a small crack in the bone or severe bruising within the bone. In the foot, they most often occur within the second and the third metatarsal bones. That's next to the big toe. Those bones are thinner and they're longer, and they take much of the load with dancing, running, and walking. So our bones are constantly breaking down and rebuilding itself. That's called bone remodeling. So normal levels of stress facilitate remodeling. When that increases with increasing in load, this can lead to a decrease in the bone density, and stress reaction or stress fractures can occur. So who is at risk? Any dancer overtraining. So research has shown that training greater than 5 hours a day significantly increases the risk for stress fracture. Dancers with certain foot types, elongated second toes, bunions, flat feet, they're more predisposed to stress fractures. And this is a big one, I think, for a lot of the women, is being underweight, low vitamin D levels, eating disorders, and not getting your period. This is a perfect storm set up for a stress fracture, and training on the improper unsprung floors. So some of the symptoms, pain and aching and tenderness over the area during and after activity, swelling on top of the foot. You could see the difference between these 2 feet. This foot has a stress fracture. There's kind of this redness that will occur in the swelling. You don't see the tendons and the other areas of the foot that are more pronounced on the contralateral side. Pain begins to increase even with daily activities as it progresses, and you'll get bruising and swelling at the site. So oftentimes I'll see patients will notice a bruise, then it goes away, and then it comes back, and that's usually one of the telltale signs. So how do we diagnose stress fracture? First is we get a plain x-ray. They usually do not show anything for the first 4 to 6 weeks. So the physical exam, there's usually pain over the area to palpation. I always use a tuning fork. Tuning forks are very diagnostic for vibration on an affected bone. And that's usually one way that I know that this bone is under stress. Hopping on the affected foot is usually very painful. We could get a CT scan or a bone scan. I generally don't do that because CT scans are a lot of radiation, and a bone scan, you have to have a contrast medium intravenously, and it's not specific for stress fracture. Other things can show up on a bone scan. But an MRI is my diagnostic of choice. It shows the early stages, and even with stress reaction before it becomes a stress fracture. And it's a magnet, it's a safe test, and it can also distinguish between, is this bone or is this a soft tissue injury? So the treatment. First is rest. Usually I will put patients in a boot for the first 2 weeks, and then we'll go into a stiff sole shoe 4 to 6 weeks in general. Ice to help control swelling. Supplements. I always get vitamin D level. Most everybody is at some point deficient in D, and it's so important for bone remodeling. Time off a dance, of course, and to begin cycling, swimming, upper body, and core training. I use something called comfrey salve. It's a wonderful product. Comfrey is a root and a plant that has been known for many, many years, hundreds of years. They used to call it knit bone. It works to help with bone healing, cell regeneration for tendon, ligament. Twice a day, my dancers will apply it on top of the area. I've also used, with a lot of success, therapeutic magnets. They help to draw blood to the affected bone. This is one of the things that I did a lot in the military, because we didn't have a lot of modalities that we have today, like laser therapy and ultrasound. So I would often have the Marines or the sailors, and even my dancers now, just tape a therapeutic neodymium magnet over the area like 6 to 8 hours a day. And you can literally see the area will be like red as the blood is flowing. So how do we prevent stress fractures? Cross-training to build strength in all areas of the body. One of the areas I find dancers today are most weak in is their core and their quad. So helping to have that cross-training and building up muscle in other areas is very important. Gradual increase in training. As we talked about initially, most of the stress factors are occurring when you start to increase your training. So coming up on competitions, coming up on the Nutcracker, it's really important to do a gradual increase in your training and having adequate rest in between. I don't think that could be overstated. Staying well hydrated, another big thing. We're losing electrolytes as we sweat. So replacing the water and the electrolytes is very important. Eating a well-balanced diet. We talked about how low body fat and having any eating issues can be causative, because the lower the body fat, the less estrogen is, and estrogen is one of our bone protector hormones. So when dancers aren't menstruating properly and their body fat is low, they're decreasing their bone density literally because of low estrogen. So this is a big deal. And I'm very big in supplements. You have to have vitamin D3, calcium, minerals, and from a good quality company. I use like 3 or 4 different companies because they've really shown the test of time that their products are absorbable and they're bioavailable. Proper shoe gear when you're not dancing. So some of the companies that I like and my dancers like are Kuru, Hoka One for sneakers, Vionics, and Baird shoes out of Australia makes a great dress shoe that has an orthotic in it. It's an excellent shoe. And then for some dancers, we'll make them custom orthotics for certain foot types that are predisposed to overloading the forefoot. When they're not dancing, we'll have them in a custom orthotic. And that's the end of my presentation.
So without any further ado, Dr. Lisa Schoene, welcome.
Thank you, everybody, for coming. I'm going to try to share my screen. So I think from what I see, I think we're all going to have really great presentations, and they're all going to kind of overlap a little bit, which is always good, because I think hearing things a few times for dancers is always really important. So we're going to talk today about perfecting your point, and I think Dr. Randolph is going to have a little bit of some similar things as well, which hopefully will just be great. So one of the things that I find when my dancers come in, my younger or experienced dancers, is that so many of my dancers will say, I just can't quite get over I just can't get a good point. I feel like I'm stuck. I feel like I don't have the proper articulation. And I feel that that's such a common thread through whatever type of dancer, young or old. So I am kind of crazy woman with my patients in the office, teaching urban exercises, kind of a little tweak to kind of maybe what you're already doing. So how do I get a strong pointed foot? Well, we have to look at, again, kind of looking at some of the little bit of the pictures on the videos that were sent and shown to us earlier. We really have to kind of focus on the actual muscles in the foot. The strength of all the muscles in and out, inside the foot and outside the foot are absolutely paramount to getting a very strong, very efficient foot that's going to allow you to land, allow you to be up on point, and do all the beautiful things that you have to do in the studio and on stage. So we have internal and external muscles, or we call them intrinsic or extrinsic muscles. When we are in proper alignment, like the gal on the right-hand side, that's pictures kind of thanks to Russian Pointe, who I do a little bit of work with as well. We want to make sure that everything lines up beautifully. That ear all the way through the top and all the way through your ankle into your foot is the way you're supposed to look. So we want to make sure that, I know a lot of dancers want to have this crazy, really cashew looking foot, but when we're talking about longevity in dance, that's not the best foot always to have. And I think you have to be very careful with how you're stretching your foot and some of the things you're doing when you're standing on your toes and doing some crazy stuff that we all know happens all over the world with all kinds of dancers. So I always want to make sure that I try to enforce and kind of explain a little bit about how important this is. If you can land beautifully, and if you can jump beautifully, and you can withstand all the ground reactive forces from the stage and from your studio floor, that's going to keep you healthy. When dancers are up on pointe, it can be 12 times body weight when you're on top of a pointe shoe, on the box of pointe shoe. Even if you weigh 100 pounds, that's a lot of weight when you're jumping on pointe. So you better have that beautifully aligned foot. If you're sickled or winged, and even if you're just up on demi and you're a contemporary dancer, you're going to have problems. So it's very important. So you have to understand that the muscles in the leg come down below the knee and they enter the foot. And where they enter the foot and turn into tendons is at the ankle joint. So the ankle joint is really the lever. We really don't want to have the foot breaking apart. And if you were going to have like more of a kind of a cashew looking foot where you're flexing the foot down through the middle of the foot, the majority of your point needs to come from that ankle joint. So that's the primary lever or hinge. And so we want to make sure, because what happens and what I've seen with some of our professional dancers that are kind of toward their end of their career is that the smaller joints in the foot down below, kind of closer to the metatarsals, become very injured and damaged because they are having those ligaments that connect all the bones together become very stretched and strained. And there can be some very bad things that can happen to dancers through the metatarsals when there is too much laxity there. So it's just really important when I'm kind of teaching the dancers about the importance of, the internal muscles and the external muscles. So when we talk about the internal muscles, they're all inside the foot. So anything below the ankle is called an intrinsic foot muscle or internal foot muscle. There's 4 layers on the bottom, and there's 18 little tiny muscles on the bottom of your foot, and there's one on top, and they only do one job. They move your toes. They open and close your toes, and they stabilize your toes to be flat on the ground. So if you're scrunching your toes, that is not working the internal foot muscles. So very important to make sure that you understand the difference there. And I think I always say it's never a bad thing to hear it more than once. So you want to make sure when you're standing, when you're dancing, when you're jumping, you're landing, your foot hits the ground where your toes can be really a very important stabilizer. They kind of keep those muscles, stabilize your toes to stay on the ground nice and flat. When you start seeing hammer toes where the toes curl up, that is technically there's some weakness in those intrinsic muscles, and it can come from a few reasons, but certainly when we start seeing toes that are not very healthy, that's a problem. So the external muscles we know are all the muscles in the leg. They're coming from below the knee and they enter into your foot almost like puppet strings. At the ankle, pretty much all of those muscles turn into tendons. So again, that's where that lever system comes. We want to make sure that point is coming from that lever system. And there's 2 major primary plantar flexors, muscles that get you up in a releve and get you up onto pointe. And then there's 5 secondary muscles. There's 3 on the inside of your ankle and there's 2 on the outside. And those 5 muscles are very, very important. If I went in and took a little scissor and snipped any of those 5 muscles, you would not be able to get up on releve or up onto pointe. Although doing that might not be their primary job. If you snipped them and they were torn, you cannot get up on your toes very effectively or at all. So it's very important to know when we're strengthening muscles, kind of a little tweaking way to kind of do it. And many of you have been dancing since you've been 2, 3, 4 years of age, and teachers teach exercises a certain way. And so I'm just going to give you a little food for thought on a little different way of strengthening your foot. So again, we just don't want that cashew foot. We don't want those crazy, crazy feet. We want those feet to be beautiful. We want them to point at the right place, and we want them to be strong, because a strong foot is going to keep you dancing longer. And in the poll that we just took a few minutes ago, it's amazing how you all do foot exercises. And that was like, I think it said 68%. So this hopefully will be kind of interesting for you. So again, dance teachers have been teaching, all my dancers to kind of do their exercises just a little differently. And they're kind of going through demi. And you have to remember, the ankle muscles that come into your foot they don't work here. They work at the ankle. So we want to make sure you hinge your exercises through the ankle. And this is, again, just a little different way of thinking and a little different way of doing it. So just to get into some of the exercises. So for the muscles on the top of the foot, I always give all my dancers the first three pictures from the left to the first three from the left are all for the extensor muscles up on top of the foot. It's amazing how many dancers can't do this. And I have dancers of all ages and all types and all levels. And there's people who can't always do this. So I really encourage everybody to work on just the big toe up, little toes up, alternate them, do the little piano where you go 5, 4, 3, 2, 1, 1, 2, 3, 4, 5. Those are really important. And then we have our intrinsic foot muscle exercises, which many of you know. But again, it's interesting because a lot of people don't really know how to do them correctly. When you are really working the internal muscles in the foot, you are not scrunching your toes, because if you do that, you're working the leg muscles. You really have to make sure that you dome and that those knuckles show up like that girl on the right-hand side, and those toes stay straight, because that's what those intrinsic foot muscles don't go to the tips of your toes. So if you scrunch your toes, you're not doing the exercise right. I'm big on balls, big ball, little ball, spiky ball, rollers, you name it, all those good things you guys all have in your dance bag, use them. That massages your foot. As you massage all those internal foot muscles, it really, really, really brings blood flow into the tissue. It's great for post dancing. It's great for warming up. So I definitely I hand out balls every single day for free to my dancers. I go through basketfuls of balls in my office. The other one, if somebody has a bunion deformity where the toe kind of kicks over, you can do this little exercise. Obviously, this is not a video, but it's where the big toe kind of starts to kind of go to the side and kind of working on that. That's a tricky one, but if you kind of keep working on it, you got to stare at your foot a little bit, you can kind of work on it. I'm also big on like yoga toes. Again, I have no relationship with yoga toes, but anything you can put in between your toes, we'll call it. You can use the spacer things that you use when you get a pedicure. You can use a paper towel. You can use the official yoga toes. That is going to stretch all of those muscles inside the arch, those intrinsic foot muscles. So after a long day of dancing, before you work out, before you dance, you can use that. You can use them daily for a few minutes to begin with. And then there are some that you can even put in your shoes and leave in there. Sometimes you have dancer socks that have all the individual toes that you can use. Some of the running socks are like that. So there's all kinds of things you can use to keep those toes stretched, those little intrinsic muscles stretched. So I love recommending that. So these are the exercises. Now, this is not going to look that different to you because you're going to be like, oh, I already do these. This is the way I do it. But a lot of my dancers.
Sorry, Dr. Lisa Schoene, I just want to check in with our audience. If you could type in real quick, are you familiar with the exercises, the intrinsic, extrinsic ones that you've just seen? And are you familiar with, which I see you're about to elaborate on, but the resistance band exercises where you're pointing and flexing? I just want to get an idea of kind of where our baseline is at.
Sure.
Continue.
Yeah, for sure. Because these are all so important. So think of when a lot of my dancers will hold their TheraBand or their exercise band, whatever brand you use, and they're going to start just going through demi. They're just going to be working through that releve demi position. Yeah. And they're not really working their ankle joint. And that's not going to get you strong. So it's just a little tweak. I know you're all thinking, oh, she's crazy, but this is just a little variation of how to get those leg muscles strong. So the first exercise, you're going to kind of hinge at, you want to keep your foot like a flat flipper, just like a flat. And you want to do all these exercises with your foot straight and down. So point your foot in all of these exercises. A lot of my runners and athletes and dancers, they want to pull their toes up. They want to use, and they're just not using the right lever system. I love making a knot in the TheraBand because it's just nice. You don't have to be like moving your arm around back and forth trying to get the right angle. As the second picture where we say the winging picture, which is the E version, you see how the TheraBand is completely the opposite direction from the direction that you're moving. So you want to wing out against that TheraBand with your foot pointed, and most of my dancers will do it with their foot way up in the air and they're kind of going back and forth. So you want to keep your foot pointed. And then if you're going to do the muscle on the top, you're going to kind of pull, just put your other foot to hold it, and you're going to pull straight up, like almost like opening up a clam, like a clam shell. And then for the inversion, which is the, which we call the posterior tibial muscle or tibialis posterior muscle, that is one of those three secondary muscles. We call them TOM. Dick, and Harry. I know that sounds silly, but we kind of sometimes just use those little fun little names in podiatry. So Tom, Dick, and Harry. The Tom is the tibialis posterior muscle, which is the one on the very top right. And you're going to keep your foot down and you're going to pull in against resistance. You always want to go slow on the second part. If you do things very fast, you're using momentum. You want to make sure you pull it in and then you let it back nice and slow. So that second part of the exercise, you want it to go a little slower. And then the next exercise on the bottom, you want to do the Dick, which is the toes number 5, 4, 3, and 2. You're going to just scrunch those down, up and down with the TheraBand. And then the Harry is the big toe. This is the money shot. If you're going up on Pointe, this is your lottery ticket. You have better be strong in this FHL. This flexor hallucis longus muscle is the muscle that goes all the way down from behind the ankle all the way into your big toe on the bottom. This is the dancer's tendinitis. When you are not on point and you're not straight and you're winging or sickling up on Pointe or on demi, you are going to potentially put a lot of stress through this particular muscle. So if there's only one you're going to do in this whole page, this is the one you want to do. You want to make sure that you're really, really flexing down against that TheraBand or the band that you use, and do a set of those. And then the one on the bottom right is called the pronaos longus. So he is the muscle that actually gets you up into demi, up on releve, and you're going to put your foot up on a pillow or a bed, put your finger underneath the big toe, and you're going to push that big toe down against resistance. So the 3 muscles on the inside, the Tom, Dick, and Harry, are the tibialis posterior. That's the top right picture. The bottom 2 left pictures is the Dick and the Harry. The big toe, little toes, that's 3 of the muscles. And then the other 2 is the pronaos longus in the very bottom right, and the second picture up on the top is the pronaos brevis. Those 5 muscles are the ones that are really important. If you are strong with these muscles, you will take less stress off the Achilles, less stress off the gastrocnemius soleus, which makes the Achilles tendon, and you are going to have a better, stronger point. You're going to have a better lever system. You're going to feel much stronger, and things are going to feel better, even if you're up on a hard shoe, if you're doing Irish, or if you're in a Pointe shoe, or if you're whatever, even just doing salsa and you're just up on your toes. Anybody will benefit from these exercises. So the goal is a beautiful, beautiful, strong foot. And my beautiful, strong foot, or beautiful looking strong foot, may be different from some of the things that we're seeing, on Google and search engines and things like that. But to me, getting a very strong, healthy foot is going to save you a lot of headache and hassle and hardship with injuries. It's going to allow you to dance, I believe, longer and stronger, and keep just your alignment above your foot looking beautiful as well. So I think that keeping a good, healthy foot is going to it's just going to stop all these injuries that we're all asking about today. So hopefully this is a little variation of maybe how you're thinking about your exercises, and hopefully that will help as well. I have some of these exercises on my website. So hopefully that will give you a little food for thought. Thank you for listening.
Thank you so much, Dr. Schoene. I actually have a quick question, and I wanted to know, do you have any videos up? I'm wide-eyed about this, because I know even for me, can anyone relate? Like, I go through periods where I'm taking more dance classes and sometimes even performing, and when I'm not, and I wish that I could just keep my feet strong in this way in between. So do you have any videos or anything?
I have on my website, I do have little videos on my website for pretty much all of these exercises. So yes, yeah, it's on my little dance page. Yep.
Our third guest, last but not least, Dr. Jessica Randolph. Welcome.
Thank you. So Healthy Points, and I'm Dr. Jessica Randolph, and I'm with Surgical Group of Arizona in Phoenix, Arizona. If anybody, needs to come in and see me. But one of the things that I'm here to talk about today is just happy, healthy feet and how to stay healthy and dance until your bones turn to dust, basically. One of those ways that I talk with all my patients about, my patients in general, especially my dancers and my professional athletes and all my other athletes, is proper biomechanics and proper alignment. Whatever you do, you're not trying to make a picture. You're trying to be true to your own alignment. Being true to your own alignment, make sure that all those muscle pulls, those levers and pulleys all throughout your body are in the proper position. It's when my dancers or my professional athletes come to me and go, gosh, this hurts. And I didn't do anything in particular. I didn't fall down and hurt myself. I go back to just very, very basic, just anatomical alignment, making sure the bones are stacked on top of each other. And that's generally where I find the pathology is when something's just slightly out of alignment. So I always make all my dance when my staff schedules my dancers in my office, I make sure my dancers come ready to move. They don't necessarily have to be in tights and leotard, but they do have to be in clothes they can move, and I can watch them move in. I make sure they stand in proper alignment. I talk about their alignment in their hips. I talk about the alignment in their knees. I talk about the alignment, especially in their foot, since I'm a foot and ankle specialist. But sometimes I find that the actual problem driving their foot pain is something more proximal up the chain, and I get them to the appropriate orthopedist if that's the case. But we talk a lot about your foot connection to your body, your foot connection to where your knee is, to where your hip is, and how that changes the position in your foot on the floor. So I'm, knees over toes, making sure your knees, your rotation in your turnout starts in your hip socket. I ask all my dancers, whether they're 5 or whether they're 75, how do you find your first position? What do you do to get to first position from parallel? And I watch them do it. And then the way that I always recommend is just to rock back onto your heels, fan your feet open, and wherever that position goes, that's your first position. And you need to work from that position. If you try and start tweaking your feet in a different position, you're actually putting stress on your knees and your hips. And we're at 10, maybe that you don't feel that, but when you're 15, 16, 25, you're definitely going to feel that in your hips and your knees and translate down into your foot. So I talk a lot about alignment with my dancers during that appointment. And then just specifically to which dancer, what's out of alignment or something. And a lot of times I can fix the problem by just getting them back into proper alignment. That being said, the alignment of your foot connected to the floor is actually a tripod. The weight of your foot through the floor, whether you're in parallel, whether you're in first position, fifth position, fourth position, third position, pick a position, your foot is a tripod, and you need to make sure that you can feel all those spots on the floor. So those spots on the floor is underneath the first metatarsal head, the fifth metatarsal head, which is underneath the big toe, underneath the little toe, and then underneath the heel. And just like if that tripod is out of alignment, your foot is going to be out of alignment, and the pulley system through the ankle that we were talking about earlier is not going to function properly. So then you're going to develop a tendonitis, an injury, an overuse type of thing in that area that is out of alignment. So I make my dancers, and actually all my patients, when they come in and talk to me about a tendonitis anywhere, make sure they stand on the floor barefoot and see if they can find that tripod position. Sometimes it takes a little bit to find it, but I have them, give them a little homework and send them home to try and find that tripod position. And then having that tripod in the proper position can also, if you're a little pronated, if you're starting to develop a little bit of a bunion, that can help, especially in a flexible foot, can help alleviate some of the pain that's starting to happen from those bunions and things. I can't advance.
As your work, you might want to exit out of it. Not exit, but like do escape, because this happened with our first presentation. I don't know if that'll make a difference. And I will say also the tripod concept has helped me so much with balance. It's been a game changer. I didn't do yoga since before the pandemic started. I did it for the first time a few days ago. I've never had so much balance, and it's just because I got used to working the tripod. So I love that concept.
One of the things that a lot of young dancers will come to me and talk about is I want to do that, I want to move up onto point. Am I ready to move up on point? A lot of times moms will bring their little dancers in and want those x-rays to find out if their joints are ready, if they're healthy enough to go on point. I do a very comprehensive pre-point exam. I don't necessarily do point shoe fitting. I'm not trained in that. I have other people in the valley here that are trained in that, and I refer that out to them. But I definitely assess the health of the foot, the longevity in dance. In my belief that you need to have been doing ballet for about 4 to 5 years before you even think about trying to go up on point. And that's to develop all the strength that you need to get on point. Any little out of alignment thing that happens flat is going to translate and be even more amplified when you go up on point. So I just make sure, first and foremost, that the ankle range of motion, which is kind of the first one on my point evaluation, is appropriate to get your foot into that position going up on point. And I do x-rays of my patients on what's called a 3/4 point over here that you see on my x-ray. And I do the 2 views, the side view like this, and then kind of a front on view, and just look at the alignment and look at specifically the kind of where the weight is, because it's a weight bearing x-ray through the foot. And then I'm looking at the alignment of the ankle joint itself, making sure you can almost make a 180-degree line through the foot, through the ankle joint, and through the toes, so that you have that range of motion at the ankle joint that you need. The next thing is I watch my dancers do demi-plie and grand plie, making sure their weight stays over that second metatarsal, that second toe over the foot, and there's no wobbling. I make them do a nice long 4-count demi-plie and a nice long 4-count grand plie. That's 4 counts down and 4 counts up, just making sure that nothing wobbles in those hips. And then the other thing is just the hip strength in general, where yes, I'm assessing the foot and looking at the foot and making sure the foot's strong enough. But if you don't have the core stability and the hip flexor strength, then you're going to potentially cause injury on your foot. You're not going to be strong enough to hold yourself in the right position up on point. I do another thing that's called the airplane test, which is kind of an eye opener to some of my dancers. It's where you're standing on one leg and you're actually parallel, and your top of your body is flat over your leg, and your arms are out to the side. And I have them on one leg do just little demi-plies. And what I'm looking at is the hip strength, to make sure there's no wobbling in that hip, to make sure you're strong enough to just hold yourself up on point before you go up on point. And you have to do it on both sides 5 times.
I love the airplanes. It's such a great strengthener, period. I love those.
And then I also give my dance, if they're young and they're not quite ready to go up on point, I give them these give them my list of things that they have to be able to accomplish before they can go up on point. I watch them do pirouettes, make sure that they don't, make sure they have the stability in a nice, single, beautiful pirouette from 4th position. And then the other really big thing I watch my dancers do is, aside from, jumps on one leg and jumps in coupe and jumps in second position or first position. The other thing I have them do is something called a Romberg's test, and it's a modified Romberg's test. So I have them just stand with their feet flat, stand up nice and tall using their core strengthening, and just have them close their eyes. A lot of where we balance from is with our eyes open. We're all very visual creatures, so we'll use a lot of visual cues to balance, but I want to make sure that the core is strong enough in order to go up on point. So I take away those visual cues and see kind of really how strong the core is, and then I have them go up on first position, up on elevate with their eyes closed, and see how much they wobble, and then give them that exercise to do at home. So if on x-ray, if their joints are mature enough to go up on point, and if they've passed all my little exercises I make them do, they're sweating by the end of my exam. Then I say, go for it. Let's go up on point and, have fun, have a beautiful career, and stay in proper alignment. If they're not quite ready yet, then I definitely do give them the exercise to do. I work on a follow-up in a few months and kind of see where they're at. That age range, as of course, skeletal maturity happens a little bit different age in everybody, depending on nutrition and genetics and health. But it's generally about 12 years old. If you come to me and you're 10 years old, more than likely, I'm going to give you the list of exercise, kind of see where you're at, talk a lot about nutrition, and then have you come back in a year or two to make sure that your joints are really ready to go on point. It is a lot of stress through your feet to be up on point. So you just got to make sure your feet are healthy and strong enough to do it. And then that'll keep you doing point for a very long time. So another little thing that can happen is just at that ankle range of motion, there is something called a little accessory bone that can happen. And that's that little bone in the back of the foot. And it acts like a doorstop so that you can't point your foot to the appropriate position. So you come in and your teacher's telling you, point your toes or get a little bit further up on your 3/4 point, and you just can't do it. You've stretched until you can't stretch anymore, and your foot's just not moving. It feels like there's a hard stop. It's probably because there might be a hard stop. This little accessory bone in the back of the ankle, it's called an os trigonum. It's in literature, it says it's about 10% of the population. In actual looking at x-rays all day, I think it's a little bit more than 10% of the population. The population that feels it is the dancers, the gymnasts, and the actually competitive divers. So if you want to have that range of motion to your ankle, you want to successfully go up on point, and you're having some Achilles tendon pain back there, and you have this little bone, a lot of times I'll surgically remove that little bone so that you can go up on point and do, or even 3/4 point. I have a few competitive dancers that they don't do point, but they were having significant Achilles tendon pain. So I've removed the little accessory bone in their ankle also.
Was it immediate pain, or was it after a certain amount of years?
Generally, it's later teenagers. They've been dancing for a while. Some of them already are on point. I had one little dancer that she actually broke hers. I had to remove, a lot of times they're on both sides, so you have to you can't do the surgery both feet at the same time, unfortunately. But I've had to remove both sides, and you had to go remove the broken side and then go back and remove the non-broken side at a later date.
And just to know, we have just a few more minutes for
sure.
Q&A. Yeah.
Sure. So this kind of shows the difference between one foot on point in the proper position, and then the left foot over there has a little accessory bone. And if you look at where the back of the heel is, on the right side, that is the appropriate position. On the left side, you just can't get there because there's that accessory bone. Mm-hmm. And then this is kind of a lovely telling picture. Preoperatively, the one that has the smiley face facing us, that's the one that needs the little accessory bone removed. And you can kind of see the little toe on the other side poking through. That's the side that is already been removed. And then that's postoperatively, a few weeks later. After some rehab, it's a minimal rehab, but it's still some rehab. And I can talk about that in question and answers if anyone wants to further information on rehabbing on a dancer after foot surgery. And then the final thing I just want to leave you with is that dancers are athletes. We need to treat ourselves like we are professional elite athletes, because we are. So that means good nutrition, good hydration, eating enough to fuel your body for what you do. And then that also prevents, like what we talked about earlier, so stress fractures. So the biggest thing is just to remember that we are professional athletes as well, not just, working to be professional athletes. So any of those things that we try and do to look a certain aesthetic but aren't necessarily healthy for our bodies are not going to keep us dancing until our bones turn to dust.
Thank you so much. And
Hi, I'm Casey Jones, and I'm a co-founder and COO for Apolla Performance. Apolla was created out of the deep need to help the toughest athletes in the world, dancers. We make compression footwear for dancers that help you do more of what you love, longer and stronger. And as a lifelong competitive and collegiate dancer, I suffered from the injuries dance sustains to our minds, bodies, and souls. And then I grew up to get my master's in kinesiology. I got my registered yoga teacher certificate and my NSCA, CSCS, and CPT. And we figured that dancers' injuries are caused because they are slow to adopt the sports science technology that has helped all other traditional athletes reduce injuries and perform even stronger. We are so grateful for them putting on this workshop so we can join the conversation about feet. Apolla created footwear for dancers that fits in any genre or need. Apolla socks provide arch support, ankle stability, energy absorption, and the option of grip, so you can easily replace your dance shoes. Dancer footwear is outdated and was not created with the athletic dancer in mind. Forget about what dancing barefoot can do to you. Studies have even shown dancer footwear to be the cause of injuries. Even on sprung floors, the repetitive motion and impact of dance will eventually create injuries that not only could sideline you from your dance season, but could turn into chronic injuries now or in your 20s or 30s. From class to stage, conventions, and recovery, we have a style that can help you dance longer and stronger. Did you know dancers have twice the injury rate from the knee down as football players? 65% are due to overuse, repetitive strain, and inflammation. We love partnering Doctors for Dancers because our aligned missions. Dancers are athletes and need to treat their bodies as such. We are so grateful for them putting on this workshop so we can join the conversation about feet. Dancers do not need to suffer through pain for the antiquated traditions that are dance. We are artists. We should be pushing back on the norms and evolving with the education that dance science and medicine provides, not wear pain and injury as a badge of honor. Research shows us that the majority of dancers, one, do not go on to have a career in dance, but 80% grow up and say they had a negative experience. These are the patrons of dance that we want to have support the art as adults. We want them having fond memories of their time as dancers. But two, the culture of dance affects a person's mind, body, and soul and often creates chronic injuries to your body, anxiety, eating disorders, or depression that we continue to suffer from as adults. This isn't necessary to enjoy the love of dance. We just need to train smarter, break the traditions that hurt us, and embrace the dance science and medicine provided to us from the specialist you heard today. Apolla allows you to feel the floor, show off your gorgeous lines, and build strength. They help you be more aware of proprioception and alignment, all while reducing the risk of the leading cause of dancer injury. Make sure you have a pair for conventions that are non-traction for those awful carpeted convention floors, a pair with traction or the barefoot style jewel to wear during class or performance, and then have a full coverage non-traction pair to slip on after dance to make a more efficient recovery so your feet are fresh and ready for you the next day. Apolla socks are an investment in you. They are a premium footwear that will not only outlast any other alternative, but they're made from sustainable yarns. We're an all-female owned small business and 100% in the made in the USA. Beyond our satisfaction guarantee, we also want you to know that we have the seal of acceptance from the American Podiatric Medical Association. We have 3 independent studies and more to come that show that we are effective in reducing force and are superior when compared to other socks, ballet shoes, or bare feet. And we hope you join into our social media community where we bring you evidence-based information and education to help you do more of what you love. Please don't hesitate to reach out with any questions because we are here to help.
I want to thank Doctors for Dancers for putting on Keeping Your Feet Happy, for our specialists joining, and for all of you joining, because this isn't only for us. The more information we have, like as dancers, we get into the studio and we chat. We share the things that we've learned as teachers, as specialists. Every piece of information is so important. So seriously, thank you everyone, each and every person for joining this Zoom, for registering. Be sure to follow us on Instagram. It's so beautiful where, all these people we have from all over the world. Also, you can keep in touch with me on Instagram at GoGalit, Gogalit. I love this growing community, and yeah, have a wonderful Sunday. I was going to say Saturday, Sunday.